That was literally the hardest test to date. It was so hard. But I am very proud of myself because what I didn't do was go back and start changing answers. If the question wasn't already incomplete or I marked it, then I didn't go back and review it. And I love that for me. Hey y'all, welcome back to Made It to Medicine with Fix. That's me, and I'm a third-year medical student currently on my internal medicine rotation. Like, it is lunchtime, real time, lifetime, okay? And I was like, let me get this video in while my coughing is not hacking and I'm feeling kind of good to do this recording. So here we are. I come to you weekly with videos about my pre-med, term med school life, a little bit of everything in between. And I wanted to close out the pediatrics rotation, clerkship, if you will, and just jump right on out the gate. I failed the test, and I failed it by 2 points. So what does that mean for me? What does my future look like? What's really going on? So when I started peds, people told me that was one of the harder exams, and I'm just like, yeah, I hear you, because we didn't really learn a lot of these conditions, syndromes, diseases, disorders. We didn't learn a lot of this pathophys during M1, M2 year, which is called my preclinical years. And while doing questions, I'm like, this stuff is just so hard. I kept up with my UWorld questions. I kept up with doing the NBMEs, which are the practice exams weekly. And my second NBME, I got like a 70% on it. I was like, oh my gosh, I never scored a 70%, especially this early in the game. Like, is this not gonna be so hard for me? When I got to the exam, y'all know I have a history of changing answers on exams, not trusting my gut, you know, having high anxiety. I didn't do none of that. I didn't change nothing. If I flagged the question, if it was incomplete, those are the only ones I went back to answer. And then when I had that inkling to go and change answers from other questions I previously done, I was like, girl, we're not about to do this. We're gonna trust ourselves. We're gonna move forward. And then I walked out like oddly at peace. And I don't know what that says for me, because the first 2 exams I definitely walked out like, dang, I failed, and I didn't fail. And had I not changed the answers, I would have high passed or honored those rotations, being family medicine and OB-GYN. But this time I walked out, I was feeling at peace. You know, I still did my post-exam ritual, went across the street to the student center to the gym, and I swam for about 45 minutes, took my time to take my hair down, wash my hair, then went home, you know, was chilling out. I was like, wow, this is great. And then the anxiety started, because typically our exam scores come back on Wednesday of the following week. But the software, the system that we received the scores through, it was gonna be down on Wednesday. So they were like, y'all gonna get y'all scores on Monday. And I was like, y'all about to hit me up with more nights of restlessness and anxiety while sleeping. Like, what are we doing? I had to take like a Benadryl so I could sleep through the night. I was like, yo, this is wild. And I had like an inkling that I didn't pass. And then on Monday we had internal medicine orientation, and I saw the message and I was like, now I missed it by 2 points, which is essentially 2 questions. I failed by 2 questions. And so I definitely immediately started crying. I called one of my friends and they were just like, oh, that's not good. And I was like, oh, I'm gonna have to get off the phone with you, because obviously it's not good. And no shade to you if you watch it. Like, I know they weren't trying to comfort me with saying that's not good. That's just like a filler word for some people, you know, like, oh, dang. Like, their phrase is, that's not good. But I didn't need to hear that's not good right then, because I knew it wasn't good, you know, especially with my situation. So I then called one of the deans from the school, and I'm like, look, what's the plan? Where do we go from here? Like, how do you say that I should proceed with peds being one of the more difficult exams, and currently on internal medicine, which is the foundation of medicine? Like, how do you think that I need to move forward with everything? Is it still recording? It is, sorry. My watch had went off and I was like, yo, are we recording? Are we wasting content? Like, what's going on? Okay, sorry. Anyway, let me focus. So she recommended that I focus on internal medicine. Like, obviously, I'm gonna have to do the retake exam for peds. And so the rule is the same as your first 2 years. You can retake any exam, but if you fail the retake, like first 2 years, you have to repeat the entire year. So for clerkship, you won't have to repeat the entire year, but you'd have to repeat the entire rotation. Y'all ain't repeat no rotations. I mean, I've had retake exams before. It's not the end of the world. Like, I literally was like, I mean, whatever. But the difference is, for this, I can only get 2 points for my exam towards my score. So I'm hoping that I honored clinically for peds, because even if I get the 2 points, I'd still be able to like high pass the rotation and maybe possibly still honor. I'm not sure though. I'll have to further look into that. But so you don't get to like let's say on the retake, if I score like an 85% and that's maybe like 4 or 5 points towards my overall rotation grade, I could still only get 2 points because that's the lowest amount of points that are available for you. I'm just like, all right, cool, whatever. As long as I don't fail this retake and have to retake the entire rotation, because I'm not retaking anything, y'all. This school is not getting no free money up out of me, and free money that I don't have because I'm not even sure my scholarship will cover that, right? So the plan now is to finish internal medicine. It's 8 weeks long. I was planning to go straight into surgery after this, but instead I'm going to take 4 weeks off, go on vacation, and study for the PEDS shelf exam and retake that in July. Like, even though internal medicine is all adult medicine and have nothing to do with kids, but the foundation is still the same. So that means the physiology, the pathology, the pathophys is still the same. I'll be learning all that and strengthening my skills. I saw that I performed very, very poorly in cardio and pulm, which is the heart and the lungs. And I worked hard on that. So I was kind of confused. Oh, I thought somebody was coming in. I had worked really hard on that. So I was kind of confused, but I also had worked hard on GI, endocrine, repro, so reproductive systems, and musculoskeletal, and those scores shot up. So I was like, you know what? We are going to take the good with the bad. Like, we're going to acknowledge all parts and not just say like, oh my gosh, catastrophize and my life is over. Like, how does this keep happening to me? Even though on the day of, I did say all of those things, okay? Because I'm human and I do catastrophize and I do like blow things out of proportion, and I do think like the whole woe is me, like why is this happening to me? And again, like, yo, my track record is really giving. You know, we have these failures, we stumble a little bit, but we don't fall. We get back up. We learn most from our failures, right? But I can't lie, having a lot of successes would be nice, you know, to have like a long streak. And 2024 has been very, very good to me. I've had a lot of wins, and this is just like one minor hiccup. You know, I'm not going to say now that the year is awful and like, oh, it's over, because it's not. Like, I'm still having some huge wins this year, this time. So I am very proud of myself for going through that rotation, getting some great feedback. So like, my clinical skills are there. I just need to work on some of that base knowledge a little bit more, in particular for cardio and pulm. And so yeah, overall though, the pediatrics rotation, it was cool. I did like being in newborn nursery. The worst part of newborn nursery, the last 2 weeks of the rotation, was having to get up at 5 o'clock in the morning. That was the worst part. The best part was seeing newborn babies. Like, fresh baby smell is amazing until the attendant was making us all change diapers, because fresh baby poop is just super smeary. And I was just like, I have used about 10 wet wipes on your little bitty behind, and that's crazy. I love clinic through and through. I'm a clinic girly. The being in the ambulatory clinic, which was basically like general clinic, or even a nephrology clinic, that was great for me. The PICU, I told you I didn't have no patients, so I didn't get to see any sick kids, which is also good because I don't really do sickness. I know you're probably thinking like, how you don't like sickness and you want to be a doctor? Well, let me tell you, because I like the outpatient stuff. Like, come to me for your wellness visits, your annual physicals, your athletic upkeep or medication management, or you need an injection, or you need like a screening done. Like, I'm your girl, holla at me. So we're going to continue to explore those interests as I go through the rest of my rotations. But all in all, PEDS was cool. The ED was a little bit like, it was fast paced, which is what I love, because that felt like clinic. But when it was like just real slow, I was like, oh my gosh, this is awful. And everybody had a freaking URI, a upper respiratory infection. Everybody had bronchitis, or that's not even an infection. Everybody had like croup, which is laryngotracheitis, or why am I not thinking of things right now? Oh, like the flu, or adenovirus, or rhinovirus, a COVID. Like, everybody had some type of upper respiratory virus, which was common for that time of year. Now we moving into like actual spring weather where it's 70 degrees outside, and I have an upper respiratory infection right now. I don't know if you can hear it, but point being, PEDS was cool. I am happy that I was open to the specialty. I was open to exploring if I could solely work with kids all the time. The answer is no. I did like the teenagers. They're kind of funny because I love like when teenagers come in all shy and I can like break their shell and get them to talking to me. Like, that's real cool. The little kids, sometimes like when parents came in with multiple kids on a visit, that was a little bit overwhelming for me. And I get it as a parent, because me, my sister, and my brother, we the last 3 in age, and so like separating him from my youngest sister, it's a 3-year gap. So obviously my mother is going to take all of us to the doctor at the same time because it's easier for her. But for me as a provider, I was like, oh my gosh, we got one kid running around, we got one kid crying, and I see the parent is like, my patience is getting thin, like what is going on. So to me, that part was a little bit overwhelming, but when it was just one kid one-on-one, I did appreciate that. And learning from the different syndromes that I hadn't seen or even heard of before was interesting. Dealing with chronic illness was a little bit hard for me, like seeing children, like I saw a premature baby that was less than 3 pounds in the NICU. That was very hard because one of my nieces was born premature at 2 pounds 14 ounces, and I believe that baby was that weight at the time I'd seen them, which was like 2 months old. So they've been born with 1 pound or something ounces. So that was a little like, oh, this is too much, because when she was born I was in 8th grade. I only like heard about her being that small. I never saw her until she got out of the hospital, because obviously kids are not allowed in the NICU. Or seeing kids with chronic kidney disease, or talking about them needing a kidney transplant, or talking about kids who've had transplants and fighting transplant rejection. Managing like the illness part was kind of difficult, but also knowing that children are very resilient and you'll have a lot more wins than losses with kids, that was comforting for sure. All in all, peds was a great rotation to learn like many different aspects of inpatient, outpatient, critical care with the ICU, or even being on the wards, or like, you know, maintaining the illness. I 110% love being on my clinical rotations. If I had to do all this all over again, I would not, because you can't have me go through my first 2 years again. I hated it. I hate just sitting and studying and reading out of a book all day. Studying for 12, 14 hours a day. It's not sustainable. It's not good for my mental health or wellness. That's why 2023 was so dark for me. 2024 is so bright, it's so light, it's so vibrant. And I'm happy to be here. Can't wait to tell y'all more about internal medicine and how I'm enjoying it, or the things that I'm learning on it. But you'll catch that in next week's video. I'll see y'all next time. Bye. And something that she said that really stuck with me was that woot, back on my way to the hospital. Back on my way to the hospital. Yeah, I have nothing else to say, but I'm back on my way to the hospital today. Yeah. I just love that y'all can see me in my little element and outside of my house, because it'd be a little wild, okay? Like different times, different dicks. Yeah, I ain't got no bars, so let me stop. Let's do this one more again. All right, so what's very ironic about the fact that after recording this video on campus, around all these people in this medical field, right, I ran into the physician I work with on my pediatric specialty week, and she was also the physician for my doctoring course, which I've told y'all about previously, which we do our M1, M2 years. It starts off by like teaching you how to take a patient history, how to look for pertinent positives and negatives, how to do a physical exam. We did like breaking it down for MSK, GU, so that's genital urinary exams, so like sensitive exams on patients. And she was very happy to see me, and I was just like, look, I failed the exam by 2 points. And she was just like, oh my gosh, I am so sorry. And I'm like, look, it's fine, because it's not the end of the world, you know, like didn't nobody die, didn't nobody get hurt. It did suck for a few hours, but I quickly got over it because it's not that big of a deal. And something that she said that really stuck with me was that like 5 years from now, you're going to be in somebody's residency program, you're going to be someone's fellow, or you're going to be someone's attending, and this isn't really going to matter. Like it might seem like a big deal right now, but down the line it's not going to be that deep. And I was like, you right. Like literally, who cares if I failed the pediatric shelf exam? Okay. And I'm not sitting here saying I don't care, because like, listen, we trying to excel at everything over here, but in the grand scheme of things, once I graduate medical school, or honestly, once I finish the rotation, no one even asked me about the exam. People only know I failed because I told them, right? And I'm only saying these things because I want to normalize failure. Just because you fail at something doesn't mean that you're a failure. And also, we learn so much from our mistakes, from our shortcomings, our missteps, our mishappenings. We learn so much from them. But to hear her say that, what if I were still in that place thinking that I meant nothing, I'm incapable, here I go once again failing something else. Like, this is really just my story, this is really just my life. I could have been in a place to need that word and saying like, it doesn't define you, Vicky, like it happened to you, but it doesn't have to ruin you. So I share that to say, like, anybody else who's going through something, just know that like this too shall pass. It's just a season, it's just one moment. And like, if no one else has told you that they proud of you, I'm proud of you, and know that you got this. Like, you know, keep going, keep on the good fight, and keep giving it your all, because you're worthy, you're capable, and you can do all things. And if don't nobody else believe in you, know that I believe in you, okay? You got this. And I'm talking to myself too, sis, because you got this. When you take this retake in July, boo, you got it, and you about to score high. Even though you can only get them 2 points towards the grade, we going for 100. Okay, let's go.